So today we'll be talking about the relationship between type 2 diabetes and malnutrition. So first of all, what is type 2 diabetes? To explain this condition, I have a short video. So essentially, people with type 2 diabetes, their pancreas makes insulin, but their cells don't use it as well as we want them to, leading to a situation called insulin resistance. At first, your pancreas makes more and more insulin to try to get the glucose into your cells, but eventually it's unable to keep up and the glucose starts to build up in your bloodstream, leading to high blood sugar levels and a variety of symptoms like thirst, weight loss, blurry vision, weak immune system, tingling or numbness in hands and feet. So what are some of the risk factors for type 2 diabetes? So weight is one of them. Obese and overweight individuals have a higher risk of developing type 2 diabetes. Inactivity and lack of exercise. A University of New Mexico study found that people who lost 10% of their weight through diet plus exercise saw insulin sensitivity improve by 80%. So that brings us to the next point, or the next risk factor, which is a diet high in fat, added sugars, alcohol, and carbohydrate. Race and ethnicity, people of color are at a higher risk for type 2 diabetes due to genetic factors and socioeconomic factors. High blood pressure and high blood triglyceride levels are another risk factor. With age, with people in their middle ages, more likely to have type 2 diabetes. So complications and comorbidities include heart disease, nerve damage in limbs, kidney disease, eye damage, and potentially blindness, as well as a variety of skin conditions and inflammation. So what is malnutrition? To review malnutrition, it's the idea of consuming too much or too little of one or more nutrients, and it encompasses both undernutrition and overnutrition. So undernutrition is a deficiency of energy or nutrients, while overnutrition is when you have an excessive intake of energy or nutrients. So malnutrition and development of type 2 diabetes. So type 2 diabetes has often been linked to overnutrition in the form of overconsumption of calories and energy from processed or refined foods with little nutritional value. So patients with diabetes often have a history of high blood pressure, high blood sugar, and high blood triglyceride levels, which are linked to overconsumption of added sugars, refined carbohydrates, saturated fat, sodium and also alcohol. So in multiple clinical interventions, limiting foods with low nutritional content and increasing nutrient-dense foods such as fruits and vegetables have been shown to improve insulin sensitivity. So diabetes and undernutrition. Type 2 diabetes has been linked to various micronutrient deficiencies in the forms of essential vitamins and minerals. For example, vitamin deficiency is 80 to 90% in obese individuals and diabetics in one study. This vitamin plays an important role in insulin secretion and function as it's present in the receptors of human pancreatic cells. Certain clinical trials have shown that vitamin D supplementation improves insulin sensitivity. Additionally, biotin, which is important in amino acid metabolism and gene expression, has shown to be lower in obese and diabetic patients. Depletion-repletion studies with mouse models showed development of insulin resistance in a biotin-deficient mouse, and that this condition can be reversed with re-adding biotin to the diet. Antioxidant vitamins found in fruits and vegetables like vitamin A and C have also been effective dietary and lifestyle interventions in patients with type 2 diabetes. Finally, thiamine, which is found in foods like meat, wheat, eggs, fish, and legumes. It's active in glucose and amino acid metabolism, has been shown in a double-blind crossover trial to reduce oxidative stress and improve endothelial function in diabetic patients. It's not surprising that many of these essential nutrients and vitamins are absent in food products with refined carbohydrates and simple sugars, and instead present in a lot of fruits, vegetables, lean protein, and whole grains. So the next topic we'll look at is the prevalence of malnutrition in patients with diabetics. So a concept that is often overlooked is that type 2 diabetes, especially geriatric patients, can develop malnutrition after the onset of the course of the disease. And in elderly patients, this is especially due to factors like decreased appetite, dietary restrictions due to diabetes, loneliness, and depression. So, in one observational study conducted to examine the impact of malnutrition on survival time and healthcare costs using the Center for Medicare and Medicaid Services data from 1999 to 2014, confirmed that after the initial diagnosis of diabetes, malnutrition led to an increased risk for death in the study subjects. So diabetes increased risk of death by 69% in malnourished patients versus normal patients. And malnutrition also increased the risk for death within each of the common comorbid conditions, such as heart disease and then chronic obstructive pulmonary disorder, and a variety of other conditions. So it's really important to focus on managing diet and encouraging patients who already have diabetes to eat a healthy diet, to improve insulin sensitivity, and also reduce the harmful impacts of diabetes. And this is especially true for older adults who struggle with a variety of challenges, such as decreased energy, decreased appetite, and also feeling isolated and potentially depressed. So finally, let's look at some dietary recommendations for diabetic patients that might help mediate type 2 diabetes and improve states of nutrition. So it's really important to follow My Plate and American Dietary Guidelines, which list out how much of each food group and the different nutrients that we should eat every day, and the food groups or food products that we should eliminate or try to limit in our diet, such as added sugar, saturated fat, and sodium. There's some specific dietary patterns that can be helpful, like the Mediterranean diet that focuses on eating whole foods, fruits and vegetables, and fiber, and also the DASH eating plan, which is dietary. It's a dietary plan for stopping hypertension or high blood sugar, and high blood pressure, and this focuses on limiting the amount of sodium. So regular meal times are really important to maintaining stable glucose levels, and healthy diet planning is also really important. Increasing the consumption of complex carbohydrates, fiber, and vitamins in the form of whole grains, fruits, and vegetables, and meeting micronutrient needs has shown to be effective in many clinical trials. Low glycemic index foods can help to avoid that spike in blood sugar after eating, and can help to maintain steady blood sugar levels. Reducing unhealthy fats and increasing healthy fats like omega-3 fatty acids. Omega-3 fatty acids has been shown to moderate type 2 diabetes and the impacts on health. And then avoid refined sugars, simple carbohydrates, trans fats, saturated fats, high fructose corn syrup, artificial sweeteners, and highly processed foods. So last we have a slide with the citations that I used. Okay. Thank you very much for listening to this presentation, and I hope you learned something from it.